We have Director Strategy and Innovation, PPHF, Ms. Cheena Malhotra. Thank you, ma'am, for having us here. Can you please tell us more about PPHF and the PRANAA project?
Sure. PPHF, we are a public health organization. We work across the health spectrum and we have a presence in more than 20 states in the country. Any program that we do is always in collaboration with the government of India. We do not believe in creating parallel systems, and PRANAA is again one of the initiatives on non-communicable diseases that PPHF is working on. We are one of the pioneer organization who works in non-communicable diseases, and we work on the entire continuum of care approach, starting from community mobilization to capacity building, to training of the doctors, training of the community health workers, ensuring taking the community members into the service delivery system and also following up with them once they are placed into the community. And in addition to this, we are now testing a new innovation with cutting edge technologies, and we're trying to take the NCD services closest to the rural areas with support of connectivity and cutting edge technologies. Thank you.
Thank you, ma'am.